Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. Definitely you can make use of it. This is quite convenient for the study. My dear friends, in the last class we have been discussing about concept of percentiles. Today we will have discussion on head circumference. Now, size of the head is a very good indicator of the content inside it. Now, when I say content inside the brain, that is brain, maybe the cerebellum, cerebrum, midbrain, basal ganglia, and then the pons, then ventricular system, fluid, etc. So, if the size of the head is too less, then suggest that probably the content inside the brain is not completely developed. And if size of the head is too big, maybe there is excess accumulation of the water, or there may be some extra congenital abnormalities are there. There is too big cerebral hemispheres are there, or underdeveloped or overdeveloped brain matter is there. So that we can assess. So if the size of the head is less than the expected, that is head circumference, if it is less than the expected level, usually we will call it as microcephaly, and if the same it is more, then it is called as macrocephaly. Anyway, the abnormalities of the head circumference finding should alter the pediatrician. Suppose if the head circumference is not up to the mark, definitely the pediatrician should be very alert. If at the time of the birth itself, see, two possibilities are there. One is head circumference is going on decreasing or not attaining its range as per the age. Okay, that is one condition. Another is at the time of the birth itself, head circumference is very less. Now, usually we will say 33 to 35 centimeters should be there, head circumference at the time of the birth. Now, at the time of the birth, if the head circumference is less than 33, normal baby 33, less than 33 centimeter, it is somewhere around 30, 31. Then we should assume that there is definitely some problem related to the brain, and that the problem started in the fetal life itself. Similarly, if the same occurs after the birth, that suggests that at the time of the birth head circumference is normal, it is 33 to 35, but afterwards in the first 1 year it is not gaining in the steady pattern. Only 3 or 4 centimeter, 5 centimeter, 6 centimeter is gained instead of 10 centimeter per year in the first year. Then we can suggest that, or we can assume that the problem has been started after birth. Okay, these are some of the common things. So a tape is used to measure the occipital frontal head circumference as shown in the picture, where the tape has to be passed over the occipital protuberance posteriorly and glabella anteriorly, just above the eyebrow. Tape should be of fiberglass. It should not be too stiff. Okay, so tape should be of the fiberglass. You can use the common tapes also, measuring tapes also, so they are also quite useful. We can do it, but thing is the positioning should be very important. Posteriorly the position is at the occipital frontal protuberance, anteriorly it is just above the eyebrow. So if you take too higher anteriorly, if you keep the tape too higher, then it gives a false reading. At the birth, the head circumference varies from 32 to 35 centimeter as explained earlier. The rate of increase in head circumference is related with the rapid growth of the brain in the early childhood. One thing should be very clear. What is that? The first 2 years of the life, the brain growth is very maximum. Therefore, normally the head circumference gain in the head circumference in terms of centimeter is also very high. Usually in the first 1 year, the head circumference will going to increase by 10 centimeter. If it is 35 centimeter at the time of the birth, at the end of 1 year it is almost all 45 centimeter. So now you can assume that how fastly the brain is growing. Therefore, first 2 years of the life is a rapid growth of the brain will takes place. So during the first year there is increase in 12 centimeter, 10 to 12 centimeter, and between 1 to 5 years only 5 centimeter is gained, and in the first year there is increase by 10 to 12 centimeter. Usually we will take it as 12 centimeter. Okay, in the first 3 months head circumference increases by 2 centimeter each month. That means at the end of 3 months, so head circumference increases by 6 centimeter. Every month 2 centimeter gain will be there. Okay, starting from 3 months to 1 year, 2 centimeter gain every 3 monthly. That means 3 to 1 year means because 3 into 3 6. So 6 into 6 totally 12 centimeter will be gained in the first year itself. Okay, then afterwards 1 to 3 years the gain will be only 1 centimeter in 6 monthly. Okay, 6 monthly 1 centimeter gain will be there. 3 to 5 years 1 centimeter gain will be there per year. So now you can assume how rapidly the head circumference grows in the first 2 years of the life. Later onwards, the growth in the head, that is increase in the head circumference is very slow, and it is not so much of important. Important is first 2 years of the life where rapid growth will be there. The reason is the brain growth will be maximum during the first 2 years of the life. For the brain growth, we need certain proteins which is abundantly present in the breast milk. Therefore, always we suggest that first 6 months you go for exclusive breastfeeding, because first 6 months you see 6 centimeter increase will be there in the head circumference. Okay, so therefore at least up to 2 years you keep on giving the breast milk along with the other food also after stopping the exclusive breastfeeding, because this is very important. Now you can use one formula if you want. The formula for estimation of head circumference in the first year of the life, okay, can be calculated by this particular formula. This is given by Dene et al. Okay, so normal range of head circumference in centimeter is equal to length in centimeter plus 9.5 plus 2.5 divided by 2. This formula can be used. At birth, the head circumference is greater than the chest circumference. Now two things are there, head circumference and chest circumference. But chest circumference and head circumference, when you compare, at birth head circumference is greater than chest circumference by 3 centimeter. That means 35 centimeter is head circumference, then chest circumference will be somewhere around 38 centimeter. Okay, this become equal to head circumference at the age of 1 year. That means at the end of the 1 year, usually the head circumference is about 45 centimeter and chest circumference is also about 45 centimeter. Thereafter, the chest circumference increases more than head circumference. Obvious, because brain growth will come down. That means the rate of brain growth will come down. Okay, only 1 centimeter per year is increasing, but chest circumference is increasing because of the increase in the muscle mass. Okay, so thereafter chest grows very rapidly than the brain, which shows decreased phase of the brain growth and increased phase of somatic growth. So diagnosis of microcephaly means head circumference less than the expected level, or macrocephaly more than the expected level at an earlier age helps to treat the underlying brain pathology. Now suppose macrocephaly is there, head circumference is more than the expected range, so then usually we will think about a hydrocephalus. That means ventricles are filled with the fluid. There is obstruction for the ventricular flow, either communicating or non-communicating type, leading to overgrowth or distension of the ventricular system, leading to increased size of the growth. Similarly, microcephaly may be suggestive of some of the atrophy of the brain organs, okay, or there may be early fusion of the sutures of the skull bone. So sutures of the skull bones are early fused, and now the space inside for the growth of the brain is very restricted. Okay, that leads to so many problems. But this early fusion, okay, early fusion of the sutures of the skull may also lead to microcephaly-like condition. After head circumference, we will move on to the another important thing, that is mid-arm circumference. Now this is a very useful indicator of the growth status of the child till 1 to 5 years. Okay. Now very important thing is after 5 years, this particular mid circumference is not that much of value. Why? Because after 5 years the muscle mass increases very rapidly, but up to 5 years, almost in all the children, the muscle mass of the arm is almost all equal. Now this is an useful indicator of growth status of a child till 1 to 5 years of age. This remains static between 15 to 17 centimeter during this period. The reason why we say that 1 to 5 years is good, because the mid-arm circumference remain in between 15 to 17 centimeter during these 5 years. Okay, this will not going to change. but afterwards it will go to change, therefore it is not a good indicator. Not much reliable after 6 years. After 6 years, this is not much reliable, as fat of the early infancy is replaced by the muscle mass. This is what I am telling. Okay, initially there is a baby fat will be there, so that is deposited in the arm area. Therefore, usually it is 15 to 17 centimeter up to 5 years. But after 5 years, what happens? That baby fat will be replaced by the muscle mass. So this may vary from child to child. So mid-arm circumference is measured with a fiberglass or a steel tape at midpoint between acromion process and olecranon process. Now, what exactly the point where you have to take the measuring? So you have to point out the acromion process of the scapula and olecranon process of the ulna. Okay, so take the length, draw your line, and afterwards take the midpoint. That means divide it into equally two parts. Now, at the midpoint between the acromion process and olecranon process. Okay, so that exactly refers to the area of the deltoid muscle, and that is insertion, that means bulk of the deltoid muscle, and that is the right area to take the mid-arm circumference. And as shown in the picture, this is very clearly clearly shown here. At the junction of the upper and middle 1/3 of the arm, corresponding to the point of insertion of the deltoid muscle, is the exact landmark for taking mid-arm circumference. Okay, Taylor's tape should not be used, as it is not so accurate. Now, for the head circumference, if you use the Taylor's tape, it is okay, no problem. But as far as mid-arm circumference, we will not recommend a simple measuring tape or Taylor's tape for the measurement, because it is not so much accurate. Therefore, here we will use a special type of tape which is called as Shakir tape. Okay, so this particular tape, this is called as Shakir tape, and this has to be used here. Okay, because this has got the color marking, red, green, blue, etc. Now, suppose if the mid-arm circumference will be less than, suppose 12.4 centimeter. So if the mid-arm circumference usually in up to 17 centimeter, it will be there 15 to 17 centimeter. Okay, if it is less than 12.4 centimeter, then it is considered as severe malnutrition. If the mid-arm circumference will be in between 12.5 to 13.4 centimeter, then it is considered as moderate malnutrition. Whereas mid-arm circumference, if it is above than 14 centimeter, then it is considered as normal. So anything above 14 is considered as normal as far as mid-arm circumference is concerned. But anything less than 14, it is always either moderate, or if it is less than 12.4, then definitely it is considered as severe malnutrition. A fiberglass ring of 4 centimeter diameter is passed above the elbow. Slipping of the ring suggests that mid-arm circumference is less than 12.5 centimeter and the child is malnourished. This is another method of assessment of mid-arm circumference as far as severe malnutrition is concerned. One is you can take mid-arm circumference and calculate. Another is a glass ring, bangle, is also called the bangle test. Okay, a fiberglass ring of 4 centimeter diameter is passed above the elbow, and slipping of the ring suggests that mid-arm circumference is less than 12.5 centimeter. सो एक आपको जो है रिंग लेना है, वो रिंग को एल्बो से ऊपर पास करना है. सो जैसा छोड़ेंगे तो वो रिंग जो है नीचे नहीं आना है, क्योंकि यहाँ पे अगर फैट है तो नीचे नहीं आएगा. अगर फैट मतलब यहाँ पे बहुत ज़्यादा माल न्यूट्रिशन है, तो मसल मास नहीं है, तो डेफिनेटली वो नीचे स्लिप हो जाएगा. अगर ऐसे स्लिप एक 4 सेंटीमीटर डायमीटर का एक रिंग जब आप एल्बो से ऊपर लगाते हो, वो अपने आप स्लिप होकर नीचे आ जाता है. सो इट सजेस्ट दैट the mid-arm circumference is definitely less than 12.5 centimeter, and this should be considered as a severe malnutrition. Simple test at the community level. Now, as I told, the Shakir tape or the fiberglass tape with the red. Shakir tape का जो specialty क्या है कि जब वो when it is less than 12 centimeter, that's a red marking. Okay, in between 12.5 to 13.5 centimeter, there will be a yellow marking. Then more than 14 centimeter, there will be a green marking. You can see in this tape actually. Okay, so here this is actually the red marking. Okay, so this will come over here. This red mark come over here if it is severely malnutrition, that is less than 12.5 centimeter. Then comes an yellow marking. Okay, it is somewhere here. It is not seen here. Okay, so if it is come, it is moderate malnutrition in between 12.5 to 13.5. Okay, and if it is green. Okay, if it is green, definitely it is above normal. Okay, therefore Shakir tape is considered as one of the best tape to measure the mid-arm circumference. Now, another method we can follow for the mid-arm circumference is a quack stick method. quack stick method. So quack stick method, the principle behind this method is to find out the acute causes of malnutrition. In acute malnutrition due to starvation etc., height remains unaffected but mid-arm circumference gets reduced. Okay, so child appears tall, thin and wasted. So quack test is a meter rod with a two set of markings. So इसमें एक rod होता है, there will be a rod with the markings. Expected height of the child against the various size of the mid-arm circumference is depicted in that particular rod. Okay, you can look into the figure. So malnourished child will be taller than the anticipated height derived from the mid-arm circumference. So in Mexico, Africa and India, this method is followed. Mid-arm circumference and head circumference ratio, a ratio of 0.2802 to 0.3140, 0.314 indicates early malnutrition. A ratio of 0.2502 to 0.279 indicates the moderate malnutrition, while less than 0.249 indicates the severe malnutrition. So this is one method. Okay, so quack stick method can be also followed. So quack stick is the instrument. It's a motor that is, it's a metallic rod like, and in that rod it is depicted. Okay, so for the different height, how much mid-arm circumference should be there. So that is mentioned there. Okay, so now Kanawati and Maclaurin's index, another index. So this is valued only up to 3 months to 4 years. Okay, Kanawati index and as well as Kanawati and Maclaurin's index, one more method of mid-arm circumference measurement, and it is a ratio between head circumference and mid-arm circumference. So here what we are taking, the ratio between the mid-arm circumference and as well as head circumference. This ratio should be always more than 0.31 in a normal child. Okay, so see, severe malnutrition or malnutrition can be assessed by simple method by using the Shakir tape method or quack stick method, or by mid-arm circumferences versus head circumference. Okay, and so these are the different types by which you can assess the malnutrition by keeping mid-arm circumference in point of view. So next we come to the chest circumference. Chest circumference is measured at the level of the nipples, and in an infant, as I told earlier, the chest circumference is 3 cm less than the head circumference at the time of the birth, but this will going to equal by the end of 1 year. Okay, so if the chest circumference is lesser than the head circumference, even after 2 years of the baby, okay, very very important, if the chest circumference is less than the head circumference, even after 2 years of age of the child, then definitely it is indicative of under nutrition. So this is how in the infant we will going to take, or newborn we will going to take the chest circumference. At birth, head circumference is 2.5 cm to 3 cm greater than the chest circumference. Both are equal by the end of 12 months. It will start from 6 to 12 months, it will be equal. After 1 year, chest circumference is more than head circumference by 2.5 cm, and after 5 years, chest circumference is almost all 5 cm more than the head circumference. Okay, so these are some of the basic things regarding the anthropometry. In the next class onwards, we will see other parameters of objective parameters of growth assessment. Till then, thank you very much.